Hello everyone, this is Dr. Benjamin Allen, board certified in physical medicine and rehabilitation, here to talk to you today about another topic. And today we're going to talk about aphasia. Aphasia is a disorder of language that is in news of recent due to multiple celebrities who've been diagnosed with aphasia, one most recently being Bruce Willis at the age of 67. Now, aphasia is a disorder that affects the brain in areas that are responsible for the expression and the production and understanding of speech. Now, in our brain, there are two areas that we talk about a lot when it comes to aphasia, and that is our Broca's area, which is in our frontal lobe, most commonly in the left hemisphere. Most people are left hemisphere dominant when it comes to their language centers, but some people do have it on the right. The majority of people have it on the left. And then, and the Broca's area is responsible for speech production and expression. And then the Wernicke's area, which is in our temporal lobe, is responsible for the processing and understanding of language. And when there are disorders to these areas, people experience trouble like word finding or just impaired speech in general. Sometimes they would speak in what we call a word salad and nothing that's coming out is making sense, though to them what they want to say is there, but it's just not coming out the way they intend it to. And aphasia can be caused by a stroke, brain injury, trauma like blunt trauma or a gunshot wound to the head, as well as neurodegenerative diseases such as Alzheimer's. Now, there are a variety of things that you can do if you're a caregiver at home for somebody who has aphasia. One is to read to them. Reading helps them to work on their processing. So you can read them a chapter a day or a page a day, whatever is reasonable for you. And then at the end of the chapter or page, ask them a simple question like, who's the main character? Tell me one thing that happened. And also you can practice writing. So have them write their name or write the month or the days of the week. And you can advance that depending on their level. But you have to try these things so that you know where they're starting at, and then you can measure progress. Another thing you can do at home is using music to help them produce speech. So our music center is on our right hemisphere. So in the rehab world, we use something called melodic intonation, which is a therapy based on using the hemisphere that's intact to help produce speech. So where there are deficits from the left hemisphere, we use the right hemisphere to try to pull in speech from that center. So sometimes we'll have patients who can't utter a word, but then we sing happy birthday, and all of a sudden they're singing, and they're saying happy birthday to you, happy birthday to you. Or you say, you start a song and say, don't worry about a thing. Then they respond, every little thing is gonna be all right. And people are amazed and they're like, they couldn't say anything, but they're singing. So we're just relying on a different area of the brain to try to produce speech. So when you use this, you can try to put a word to a melody and see if they can produce the word by using a melody rather than just saying it generally. So if you want to look up more information on melodic intonation, you can probably find videos on YouTube. But I always recommend anyone with aphasia be supervised by a physician and speech therapist. That is the best treatment for someone who's dealing with aphasia. So those are just some tips for anyone who's dealing with this disease. It can be very frustrating for both the person who is experiencing the symptoms of aphasia and the person who's, the caregiver. And you can also use writing by making like a word board or some type of picture board with words on it so they can point to what they need, like general needs like bathing, bathroom, eating, if they're having pain, some things that they can express that you really want to make sure you're taken care of, because when these things aren't addressed and people are feeling the need to have these needs met, that can be very frustrating. So I just wanted to give you guys some tips for aphasia. And I am a doctor, but I'm not your doctor. So please consult with your doctor before taking on any recommendations or advice you hear here. And if you would like to work with a physician who can refer you to the most excellent speech therapist in the DMV area and help you meet your functional as well as your optimal health goals, I invite you to work with me at freedomwellnessphysiatry.com, where you can book an appointment, or you can call 240-339-5377, and I look forward to joining you in starting your journey to living better. Thank you, and I'll see you next time. Bye-bye.